Welcome friends to the second part of the pre-read of Understanding Hepatology workshop. In this series of lectures, I'll be talking about the terms which normally used for describing the RBCs. The terms that we use commonly are hypochromatic RBCs, macrocytic RBCs, anisocytosis, poikilocytosis, schistiocytes, polychromasia, normoblast. There are other terms that we also use for the RBCs, that is teardrop RBCs, target cells, spherocytes, macroovalocytes, and sickle cells. So in this video, I'll be talking about what are these cells, how do you identify them, and when is it likely that you would be finding these cells. The first term which we should all be aware of and very clear about it is the chromasia, or the color of the RBCs. Normally the RBCs, when they're adequately hemoglobinized, the hemoglobin ring would be at least 2/3 the thickness of the RBC with a faint central pallor. That is, the central pallor should be less than 2/3 the size of the RBC. If such a situation occurs, then the hemoglobinization of the RBC is adequate. When there is defect in the hemoglobinization, you'll find that the margin of hemoglobin in the RBC is less and the central pallor is more, and this is called hypochromic RBCs. When the central clearing is more and the rim of hemoglobinization is less than 1/3 the diameter of the RBC, we call it hypochromic RBCs. Now, if you have a look at this smear, which is that of a normal peripheral blood smear, you will see that the central pallor is quite limited and the hemoglobin ring is more than 1/3 definitely, and approximately about 2/3 the size of the RBC. Most of the RBCs, you will find that the central pallor is very small. This is a normal smear. On the other hand, when you look at this smear, you will find that the central pallor is much more prominent and the hemoglobinization is just restricted to a small rim in the RBCs. These RBCs will appear very pale in the smear, and this is hypochromic RBCs. For comparison, I'm showing you the normal RBCs and the hypochromic RBCs. It's very easy to make out this in a smear, and if you see this, you will start to call it as a hypochromic RBC. Important to note, the word hyperchromic RBC does not exist. Either the RBCs are normochromic or they are hypochromic. Then we come to another term which is called anisocytosis. Iso is similar and iso is varying shape. Anisocytosis is when the shape of the RBCs considerably vary in the normal smear. Now, if you look at this smear, you have a small RBC over here and you have a very large RBC over here, and the other RBCs are of different shapes. So this is a classical example of anisocytosis. Anisocytosis would be seen in iron deficiency anemia. Iron deficiency anemia, apart from the size, the shape of the RBCs also vary, which I'll come subsequently. Anisocytosis is a feature of iron deficiency anemia. Anisocytosis is another feature of nutritional deficiency anemia. In megaloblastic anemia, you get macrocytes and you have varying in shapes and sizes. Also, when a person of anemia has been treated and the bone marrow is responding to the treatment, let's say an iron deficiency anemia, supplementation with iron, macrocytic anemia, supplementation with B12 and folate. When the bone marrow starts to respond, it starts to throw the reticulocytes out in the peripheral blood smear. The reticulocytes are larger than the normal RBCs, so there also you will get anisocytosis. Poikilocytosis is variation in the shapes of the RBCs. Now, we all know that the RBC is a discoid circular structure with a central pallor which would be something like this. But if you start looking at this smear, you'll find that there is an elliptical cell, you'll find that there's a pencil form, you'll find that there are some small forms, okay, then there's another oblong shape over here. So a combination of all these with marked variation in the shape and size of the RBCs is called poikilocytosis. Poikilocytosis is a very commonly used term associated with iron deficiency anemia. Iron deficiency anemia will be characterized by a hypochromic RBC, microcytic RBC, and presence of poikilocytosis. Schistiocytes. Now, if you look at these RBCs, they're not an RBC actually, but they are fragmented RBCs. These fragmented RBCs are called schistiocytes. Presence of fragmented RBCs in a peripheral blood smear should indicate that there is some element of damage occurring to the RBCs, as in hemolytic anemias. Even people with mitral valve replacements or any other valve replacements, there also you will tend to find these schistiocytes created by mechanical damage to the RBCs. Schistiocytes, fragmented RBCs, hemolytic anemia. Another term to be used in commonly in hematology is polychromasia, when the color of the RBCs are different. Now here your staining of the sites and optimization of the staining is very important. Normally the RBC should be this coppery red in color, and if you find that the RBCs are slightly having a bluish tinge, as you can see this cell, this cell, this cell here, these presence of a bluish tinge indicates polychromasia. There is different coloring. What is the different coloring? These are reticulocytes which have come into the peripheral blood smear. So presence of immature RBCs in the peripheral smear would be called polychromasia. Polychromasia can be seen in two conditions. The first condition is an anemia which is being treated, an iron deficiency anemia being treated with iron. The response to the body will be to produce more RBCs, and the reticulocytes will come in the peripheral smear, and I'll show you polychromasia. Another case is in hemolytic anemias, when the RBCs are being destroyed at a faster rate, the bone marrow is compelled to push the immature RBCs into the peripheral smear, and there also you'll get polychromasia. Polychromasia indicates increased bone marrow turnover, either in cases of hemolytic anemia or in cases of anemias which are being adequately treated. Then comes normoblasts. In the previous lecture also I talked about normoblasts, that is a well matured hemoglobin with a pycnotic nucleus in the peripheral blood smear is called a normoblast. This is also indicating aggressive bone marrow turnover with pushing of immature blood cells into the peripheral smear. What are the features that you're seeing in this smear? Straight away you can say that they are hypochromic RBCs. There is stark variation in the size. You have a small RBC and you have a large RBC, so there is anisocytosis. Then this is a pencil form, this is an elliptical form, this is an elliptical form, so this is poikilocytosis. Polychromasia, you can see these blue color RBCs. Polychromasia is also present. Normoblasts are also present. So what are the things you're seeing in this smear? You're seeing microcytic RBCs, you're seeing anisocytosis, you're seeing poikilocytosis, you're seeing polychromasia, and you're seeing normoblasts. So this picture can occur in two conditions. What are the two conditions? One is a severe iron deficiency anemia in which the treatment has occurred and now the bone marrow is responding by producing a lot of RBCs. So that could be a classical picture of an iron deficiency anemia on treatment. Another important feature that you're seeing over here are these fragmented RBCs. What's the word for the fragmented RBCs? Schistiocytes. So presence of schistiocytes suggests that this is a smear of a thalassaemic patient, or for that matter any hemoglobinopathy patient. because there also you'll get all these features. You'll get a hypochromic, anisocytosis, poikilocytosis, polychromasia, normoblast. So the presence of schistiocytes will push on to your diagnosis, more favoring a hemolytic anemia. Teardrop cells. You can see this classical picture which is suggestive of a teardrop. This kind of a teardrop cells usually seen with bone marrow infiltration, fibrosis, any inflammatory process in the bone marrow, malignancies, splenic abnormalities, megaloblastic anemias, and sometimes in thalassemias also you could see these kind of teardrop cells. Within them, they are not a definite indicator of a pathology, but it is good to report them. Target cells. Now if you see this cell, it's classically of a shape of a target, as much as this, as much as this. A target cell indicates that the cell membrane is larger compared to the volume of the cell, so it tends to fold upon itself, giving this target appearance. Once again, a target cell is seen when the cell membrane is more than the volume of the RBC. In conditions like hemoglobin C, alcohol abuse, liver disease, both these conditions are associated with abnormal lipoprotein metabolism. Hemolytic anemias, and in post-splenectomy patients, you could find such target cells. Spherocytes. Spherocytes, the most commonly used word we say is hereditary spherocytosis. Spherocytes are characterized by a circular RBC and the absence of the central pallor. Now the absence of the central pallor is the most important thing. These are RBCs which are having central pallor, and in between them you're seeing other set of RBCs which do not have the central pallor. RBCs not having the central pallor are called spherocytes. The most common condition where you will see spherocytes in a peripheral blood smear is post-transfusion. These are the native RBCs of the patient, and these spherocytes are actually the transfused RBCs that come into the smear, into the blood. Generally, after transfusion, if somebody is asking a smear for checking the hemoglobin, send a blood for hemoglobin and a peripheral blood smear, those are times you see these spherocytes. Post-transfusion, storage artifacts, hereditary spherocytosis. Sickle cell, this was a slide I had given in the pre-test and all of you answered it properly. This is the classical sickle. Now what is important over here is that if the sickle has a central pallor, it is more like an ovalocyte. If the sickle has a pallor, it is an ovalocyte. If the sickle does not have a pallor and there are multiple such, then you call it sickle cell anemia. Now it is important to know here that there are so many times I have seen sickle cell traits and the smear looking absolutely normal. Don't take it for granted that if it is a sickle cell anemia or sickle cell trait, these sickles should be prominently present in the blood smear. No, I have seen sickle cell traits confirmed by PCR but having an absolutely normal peripheral blood smear. So that's the take-home message for sickle cells. Macrocytes and macroovalocytes. Now what is a macrocyte and a microcyte? In the previous lecture, I said the size of a RBC, the size of the nucleus of a small lymphocyte is roughly the estimate of the size of the RBC. Anything larger is called a macrocyte, anything smaller is called a microcyte. Macrocytes and macroovalocytes are classical features seen in B12 folate deficiency. Now have a look at this. This is a macrocyte compared to this. If this were considered to be the normal RBC, this is a macrocyte and this is a macroovalocyte. Presence of macrocytes and macroovalocytes should raise a suspicion for megaloblastic anemia. Now along with this, the characteristic features that you look in a peripheral blood smear in a case of megaloblastic anemia is there will be usually pancytopenia. all the three cell lines will be decreased in shape. Macrocytes, macroovalocytes will be present. Another conspicuous feature is hypersegmented neutrophils. Now, what is the definition of a hypersegmented neutrophil? Now, when you talk about a neutrophil and a segment, clarity should be there that this is one segment, this is one segment, and there is a thin rim of chromatin joining the two. This is segmentation. So if you have a look at this, 1, 2, 3, 4, 5, 6. Presence of one neutrophil having 6 lobes or 5 neutrophils having 5 lobes. This would constitute hypersegmented neutrophils. Even one neutrophil with 6 lobes or at least 5 neutrophils with 5 lobes would be required to be shown in a smear to call it hypersegmented neutrophils. So the triad that you generally see in a macrocytic or a megaloblastic anemia will be pancytopenia, macrocytic anemia, macrocytes and macroovalocytes, hypersegmented neutrophils. When you see all this, this is the picture of a macrocytic anemia. Thank you very much. I'll be coming up with another set of video shortly.